Welcome back to another episode with Bantering with ByrdAdatto. We've done almost a dozen videos and webinars in the last few months on safety needs to protect your business and practice from COVID in your facility. But what happens when COVID gets into your facility? To address these issues, we have a mini series we've put together for y'all, and we're calling it COVID Questions from Our Clients. So today's question is, Michael?
Today's question, Brad, is do I and my medical staff need to quarantine if we were exposed to a patient with COVID-19?
It's a great question. We get this question a lot. And the reason why, one of the things we always recommend is when you're seeing your patients, you should be at the very minimum wearing a surgical mask. The reason why is the CDC says that if you are wearing a surgical mask and you're with your patient for over 15 minutes and the patient is wearing a cloth covering, you would not need to quarantine yourself or your staff because that's just, as a healthcare personnel, there's an exception that the CDC has given us. We have not seen any states otherwise that have gone against the CDC recommendations, but again, that is one of the reasons why with the PPE, again, surgical mask or a dental mask or a procedural mask that's FDA approved, if you have that on, that's almost like a get out of jail free when you're treating a patient. And so, as you can see, there's a lot to unpack when it comes to COVID. There's so many different laws and regulations, but we're trying to answer each question as they come in. Hopefully, throughout this mini series, we'll be answering a lot of your questions. But of course, if you have any other questions, just reach out to us. So, thanks again for joining us today.